Hi, I'm Dr. Allen with my Houston Surgeons. This video is an overview of instructions that we give to my sinus and nasal surgery patients with useful guidance for both before and after procedures. Number 1, get any requested lab work, chest x-ray, EKG, or any other required medical clearances or tests done at least 1 or 2 weeks in advance of your surgery to avoid delays. Some findings require further studies or clearances to ensure that you're safe for surgery. Having this added time ensures that in most cases the surgery date won't need to be pushed back. Our office staff will ensure that these results are obtained and reviewed so that we can be confident that you're safely prepared for your upcoming procedure. Number 2, remember to avoid any medications that might worsen your bleeding risk after surgery. Over the counter, this includes aspirin products, including BC powder, and other NSAID medications such as ibuprofen or Advil, and naproxen or Aleve. If you take supplements and are unsure if they impact bleeding, please make our clinic staff aware and they can provide further guidance. If you're on antiplatelet or anticoagulant medications for your other medical conditions such as Xarelto, Plavix, Coumadin, Eliquis, and many others, we'll be obtaining guidance from your prescribing provider regarding the safety of withholding these medications leading up to your surgery as well as during your initial recovery. Please follow that guidance closely, as these medications can significantly increase bleeding risk following sinus and nasal surgery. Number 3, please obtain any needed supplies for post-op care, as well as any prescribed post-op medications before the day of surgery. For most nasal and sinus procedures, this includes the NeilMed adult-size sinus rinse kits, salt packets also by NeilMed, distilled water, generally 2 or more gallons are needed, as well as an Afrin spray or equivalent decongesting spray which can help stop bleeding as needed, and Tylenol or Advil for milder pain, as well as any prescribed pain medication that's needed for moderate or severe discomfort. Number 4, alert our office staff if you're experiencing worsening symptoms including fevers, productive cough, or any new or concerning symptoms during those 2 weeks leading up to surgery. Number 5, please avoid eating or drinking anything after midnight the night prior to surgery unless otherwise instructed by our staff or anesthesia staff. Number 6, avoid wearing makeup, hair products, or applying anything to your skin on the day of your surgery that might interfere with skin adhesives or tape that's used during surgery to secure things like your breathing tube. Also remove any jewelry or piercings prior to arrival at the surgery facility, as these might cause burns when electrocautery instruments are utilized in the operating room. Number 7, if you wear contacts, instead wear glasses to the surgical facility on the day of your surgery. Number 8, please bring a list of your home medications with you to the surgery facility. Their staff may not get all the records that were obtained in our office. Number 9, you will need someone to drive you to and from the surgery facility anytime you're receiving medications that cause sedation, including IV sedation, general anesthesia, or even pain or anxiety medications. Number 10, following your procedure, you can generally resume eating and drinking a regular diet as tolerated unless instructed otherwise by your surgeon. Number 11, avoid blowing your nose, sniffing aggressively, exercising, lifting with exertion, bending over head first, or any activity that might increase pressure in your head or increase heart rate or blood pressure in order to avoid triggering bleeding episodes following your procedure. For most surgeries, these activity restrictions are in place for about 2 weeks, unless stated otherwise by your surgeon. Number 12, nasal and sinus surgery patients will need to initiate post-operative saline irrigations of their nose starting the day after surgery. For nasal procedures such as septoplasty and turbinoplasty, this should be performed 3 to 4 times per day until cleared to stop by your surgeon. For sinus surgeries, this should be performed every other hour while awake until cleared to reduce the frequency of rinsing by your surgeon. These rinses should always be performed gently with the nose aimed downwards over a sink using the NeilMed adult-size rinse bottle, salt packets, distilled water, which can be warmed up to a comfortable temperature in the microwave, and slow, consistent pressure through one nostril at a time until saline is flowing out of the opposite nostril. Squeezing too fast or too hard on this bottle might cause saline to enter one or both ears, go down your throat, or might cause discomfort or bleeding. If any medications were prescribed to add to these post-op rinses, use the medications twice daily at the first and last rinse of the day until cleared to stop these by your surgeon. Number 13, nosebleeds are common after any nasal surgery and in general are mild and easily stopped with decongesting sprays such as Afrin, followed by leaning forward to avoid swallowing any blood. Brisk or persistent bleeding can often be controlled at home with additional applications of decongesting sprays, a warm nasal saline irrigation up to 110 to 120 degrees Fahrenheit, an ice pack placed at the back of the neck, as well as staying calm to avoid elevation in heart rate or blood pressure. If the bleeding appears aggressive or it fails to stop with multiple attempts, contact your surgeon immediately for further guidance. Also consider evaluation in the emergency department if the bleeding appears severe, as some bleeds will occasionally require nasal packing for control. Your surgeon can help guide this decision if you're uncertain if the bleeding warrants an in-person evaluation. This degree of bleeding is luckily rare, with a risk of approximately 1 to 2% after most nasal and sinus procedures. Number 14. Schedule your initial post-op visit when scheduling surgery to avoid any delays in care. This post-op care is essential for the best outcomes following nasal and sinus surgery. Structures in the nose are close together, and any adhesions between those structures can become permanent scars and sources of obstruction if not addressed easily within those first few weeks. When the nose is clean and the healing process guided appropriately, long-term results are optimized for nasal surgery. Number 15. Regarding time off from work or school, most patients take 1 week off following the majority of nasal and sinus procedures. Some patients avoid or do not require stronger pain medication and return to work much sooner according to their preferences. The perception of pain varies significantly, and controlling inflammation or infection leading up to surgery, followed by adherence to the post-op care instructions, ensures that patients have the smoothest and fastest recovery possible. Number 16, please refer to any printed post-op instructions given out by our staff, which might include additional details or further instructions, and please don't hesitate to ask any questions about your care. We want you to feel comfortable and confident in your decision to trust us with your health. I'm Dr. Allen with My Houston Surgeons, and thanks for watching.